This is an overview of the potential minor and major complications of sinus surgery. Please note, Dr. Setliff has done over 10,000 nasal and sinus surgeries and never had one single major complication. We'll start with potential minor complications. Scar tissue is the most common minor complication of sinus surgery. Dr. Setliff's minimally invasive techniques will help reduce or even prevent this. Some oozing of blood is common after endoscopic sinus surgery. Heavy bleeding or hemorrhage is not to be expected. Dr. Setliff may stop doing a procedure if significant bleeding occurs, but this is quite rare. He would place nasal packing and may admit you overnight. As with any surgery, post-operative infection may occur. Patients with pre-operative sinusitis have an increased risk of this. Though the Setliff Sinus Institute does not resect or remove turbinates, with the removal of turbinates, patients sometimes complain of the sensation of being overly dry, difficulty breathing, or even chronic pain. The most severe after effect is referred to as empty nose syndrome. The septum helps support both the bridge of the nose and the base of the nose. Although surgery on the septum alone rarely changes the appearance of the external nose, such changes are possible. Temporary bruising or discoloration is possible, but also rare. Much of the nasal septum is made of cartilage, which has memory, which is the propensity to move back to its original position and cause future trouble. For that reason and others, the offending cartilage is usually removed, except for the part that supports the tip of the nose. Although rare, small scar bands may occur after surgery and may require a minor procedure by Dr. Setliff at a post-operative visit. The following complications are considered to be major. As a reminder, Dr. Setliff has never had a single major complication occur in over 10,000 surgeries. The most common major complication of endoscopic sinus surgery is a cerebrospinal fluid, or CSF leak, occurring in about 0.2% of cases. The leak is usually recognized at the time of surgery and can be repaired. It should be suspected post-operatively if there is a clear nasal discharge from one side of the nose. If this rare complication occurs, it creates a potential pathway for infection, which could result in meningitis. A CSF leak extends the patient's hospitalization and could require further surgery for repair. The close relationship of the ethmoid sinuses to the eye socket puts the eye at risk during every sinus surgery. Swelling and/or bleeding around the eye, although rare, is possible, and permanent damage may occur. The ethmoid sinuses also have a close relationship to the skull base and brain. Intracranial injuries have been reported during sinus procedures. Although extremely rare, there have been occasional reports of blindness after sinus surgery, resulting from damage to the optic nerve. Such damage is almost always permanent. Diplopia is a temporary or prolonged double vision, also rarely reported after sinus surgery. General anesthesia is the anesthesia of choice and carries known serious risks, no matter the procedure. Permanent loss, changes, or decrease in the sense of smell have been reported following surgery. However, in some patients who already have decreased smell before surgery, the condition may improve with surgical intervention. Rarely, nasolacrimal duct stenosis follows sinus surgery, resulting in tearing of the eye, and can occasionally be persistent. Numbness or discomfort in the upper front teeth can occur and may persist for a period of time, but usually not long-term. Remember, you are in good hands, as Dr. Setliff has never had a single major complication.